It is my pleasure to present the 6-month clinical and imaging results from the New Zealand Bioadaptor trial. This study was funded by a research grant from Elixir Medical. Bioadaptor is similar to a drug-eluting stent, but with the addition of elements which are able to uncage. Polymer is resorbed over approximately 6 months, which allows separation of the struts and restoration of normal or enhanced vessel vasomotion, positive adaptive remodeling, and the potential to improve angulation of the vessel during the cardiac cycle. Acute performance is similar to that of a drug-eluting stent in terms of deliverability and radial strength, and sirolimus is absorbed from a polymer coating over a 3-month period. This study was undertaken at 7 New Zealand sites and enrolled lesions in vessels of 2.5 to 3.5 mm diameter and less than 24 mm in length. Patient characteristics are shown on the left. Most patients presented with an acute coronary syndrome. The reference vessel diameter mean was 2.8 mm, lesion severity 68%, and mean lesion length 16 mm. The clinical outcomes at 30 days and 6 months are shown on the right. There was 100% acute procedural success, no target lesion failure, no cardiac or non-cardiac death, no myocardial infarct. There was also no clinically indicated TLR or TVR and no stent thrombosis. Paired QCA was undertaken in 32 patients. In-segment late lumen loss was 0.14 mm, and in Bioadaptor late lumen loss was 0.21 mm. IVUS, which is shown on the right, showed that the mean Bioadaptor area and the mean lumen area both increased by 1.5% from baseline to 6 months. OCT, undertaken in a subset of 11 patients, showed that the mean neointimal thickness was 100 microns, which compares favorably with best-in-class drug-eluting stents, and the strut coverage was 96%. In summary, Bioadaptor had excellent acute performance with regard to deliverability, conformability, and radial strength. Clinical safety was demonstrated through to 6 months, and there was evidence of preserved positive adaptive remodeling both by IVUS and by OCT. This technology has considerable promise and warrants further randomized evaluation and larger studies. Thank you.